kind of what's happened in a very short period of time, in the span of, you have to think about this in evolutionary terms. In the last just 100 years, if you look at kind of the 1940s, the average adult, there was about 7% of the population had a chronic condition. Fast forward to today, it's 60%. Diabetes, it's metabolic syndrome, et cetera. And this is not a disease or a set of conditions that is specific to aging, which many tend to attribute to. When we're getting older, so of course we're going to get ill. These are happening across every demographic group. We spend $4.3 trillion, more than any industrialized nation by any stretch, on caring for the sick. And this is not a sustainable curve on an economic term, but we are heading into a crisis. So that's one part of the situation, kind of why Mend was born. For me personally, I had a number of family experiences with healthcare and with illness. I started to think about kind of the macro things about us being sicker as a society, and then we get you into an acute care system, and then the level of care that you're receiving. And one of the things that was very apparent to me that was absent in terms of care modalities was the deliberate use of nutrition as a mechanism through which to help you not only heal acutely, but then position you for long-term success. Under any form of trauma, the body's metabolic demands increase. The bigger the trauma, the harder the body's working to repair that tissue and address the underlying issues. And yet, when you look at medicine, that's almost always absent from the conversation. So when I really started to think about my injury that I personally had, that was very slow to heal from training for the New York Marathon, and I went back to my podiatrist and said, why is it taking so long to heal? He said, go home and rest. And that was an unacceptable answer for me. So I started to think about what am I nutritionally compromised? Is something about the healing process that was delayed? And so Mend is about a much more proactive attitude and approach to healing, taking evidence-based modalities, and addressing some of the lack of care in acute care that is only going to get us exacerbated over time, given the tremendous pressures healthcare is in. And so the idea with Mend is that not only are we going to use an evidence-based food as medicine modality, and I'll unpack that for you, but we're actually going to help provide the level of support, coaching, monitoring that's really needed pre and post an acute care event like a surgery, a major surgery, to ensure that that 79-year-old, 80-year-old, 81-year-old is doing all the right sets of things for surgical readiness so that you go in like you're going into a marathon, well-trained, body ready, body strong, to actually have really good outcomes. And then we're doing the right sets of surveillance on the back end of that surgery, supporting to ensure that we're watching for anything that might present risk, that could present for complications, and to ensure that the patient's having a really good recovery. So that's what we call a care blanket that really gets wrapped around with our behavioral models, our technology, and the level of support that our clinical team's providing to patients. Our clients are health systems, private practices, and what we're really conveying to them is what you do really well is you do this surgery really well, but we know that there's a whole bunch of things in a biopsychosocial model of healing, a number of modalities that are protagonists, a number of modalities that are antagonists, that we can bring to bear in a very, very deliberate technology, clinical services, food as medicine driven capability that bolts onto your practice without you having to change your workflows, without you having to install a technology, without really you having to do anything other than partner with Mend and refer your patient to an elevated level of care. We take care of the rest. Mend is doing the hard work of enrolling the patient, educating the patient, guiding the patient, monitoring the patient, ensuring that they really have good outcomes. And so what this does is it extends the care delivery model in a way that's not possible without Mend. Without Mend, they're under tremendous pressure and they need to get you out of the health system as quickly as possible. With Mend, we can provide concierge, white glove capabilities and services to every patient without having to modify anything that the physician does today. We're at a really exciting place with the firm with 15 signed contracts with providers, a number of contracts that are in very late stage. And of course, the most exciting news that we've recently announced is that Ortho Lone Star, the third largest orthopedic network in the country with 180 physicians, has decided based on a 14-month pilot to actually roll out our solution across our entire network. And they did that because they saw the triple aim impact. And the triple aim impact is patient experience, patient outcomes, and profitability. And they're seeing that consistently with the deployment of our solution, and we're now scaling. So the Upgraid platform, while we've lifted in orthopedics, and you think about it as a food as medicine core modality with behavioral navigation for our patient, is really a horizontal. It can be lifted into any indication. So we're currently designed for surgical oncology, where we'll be lifting with a major health system actually here in the Chicago area. And then we're working on a wellness care pathway. So when a patient comes out of their surgical readiness and surgical recovery, and they want to maintain their dietitian, they want to maintain their nurse, and they want to be on wellness care pathways. They're being monitored and supported. We actually have a care pathway for that. So the actual model, when you think about it conceptually, is a team of clinicians with a set of evidence-based modalities that are there with you all the time to support you through any health-related need. And we can get into prevention strategies in this way, where we're actually indoctrinating people on new sets of behaviors. And those behaviors will stay with them for a long lifetime and prevent some of the things that are causing us challenges at a societal level today. We're really proud at Men because we really do believe that we're creating a new category called nutrapharma, which lives in between the pharmaceutical world and the dietary supplement world, where we've taken natural compounds, but we apply the rigor of pharma-like approaches to develop an evidence-based solution that really can impact the key things that we're trying to address as a society: blood sugar levels, inflammation, metabolic syndrome, et cetera, that can be used safely and effectively and easily so that we can get that deployed at scale in society and have an impact. Yeah, Men's aspiration and mission is to become the world's evidence-based healing company. That's what we want to become recognized. Healing is not just something that happens in acute stage. First of all, it is physical, it's emotional, it's spiritual, it's psychological, and more often than not, intertwined. And healing is something that every human needs, not just now when we have an acute event, but we need it throughout our lives as we break down. So we want to bring evidence-based modalities, and when someone thinks of the word healing, we want them to think about MENT. My mother recently turned 81, and one of the things that keeps me up at night is what to do for her now that she's 81 and she's had, 2 major illnesses and a recent surgery. And boy, would I love to give her MENT, our Upgraid platform. We're a team of nurses, dietitians, health coaches with medicine, food as medicine modality, are continuously monitoring, supporting her into her old age so we can expend those years of well span and give her, in the balance of her life, the most meaningful years possible. And so that's what I really want. I want an impact at scale where every single human being gets the care that they so desperately need and deserve.